Aloha, everybody, and welcome to another edition of the Weekly Dose. I'm Brooks Bear for the Department of Health. In just a moment, we're going to have a very special guest. We're going to talk about COVID and a lot of things vaccination related. But first, I've got some pretty exciting news for you. We have recently announced that we are expanding the eligible pool of those who can now register for vaccinations, go to one of the dozens of sites around the state, and get themselves vaccinated. We have expanded to anyone who is age 60 and older. So if you are 60 and older, please go to hawaiicovid19.com, find a registration provider that perhaps is in your neighborhood, sign up, get yourself vaccinated. You'll be doing yourself, your family, your loved ones, and all of Hawaii a favor. We certainly appreciate all of the interest we have received in vaccinations. And now there's so many people eligible, 60 and above. Anyone who is on dialysis, on chemotherapy, or other infusion therapy, people with respiratory ailments so severe that they need oxygen, and a whole bunch of frontline essential workers, including essential workers who work in hotels and restaurants and bars. And very soon, we're going to be expanding eligibility to other essential workers. So the vaccine is on the way, and it won't be long before everybody has an opportunity to be vaccinated. So thank you, Hawaii, for your patience. And remember, hawaiicovid19.com is your one-stop shopping for all things COVID. Look to the upper right-hand corner for the word registration. Click on that, and a whole bunch of links will appear that tell you about the various vaccination opportunities around the state of Hawaii. Having gotten that out of the way, it is time to bring in today's guest. And with us is the Deputy Director of the State Department of Health. This gentleman is in charge of the Behavioral Health Administration. I welcome Eddie Mesereau. Eddie, good morning to you. Hello.
Good morning, Brooks.
Thanks for taking the time to join us. We know you're busy, but a lot of us may not know what the Behavioral Health Administration really does. So give us a quick background on all the things that fall under the behavioral health umbrella.
So Behavioral Health Administration covers all of the adult mental health services, child and adolescent mental health services, developmental disabilities, substance use disorder services, and the Hawaii State Hospital. So it's a pretty broad scope of services across the state that we manage. Anything related to behavioral health or substance abuse or developmental disabilities, we have some connection to it.
That broad scope got even broader when the pandemic started because more was put on your plate. You have now more responsibilities, and I know you're involved in a whole bunch of different activities related to COVID, related to vaccinations. Can you please tell us about some of those?
Yeah, so it's been an all hands on deck kind of effort this whole year, and so BHA, we definitely wanted to do our part. I think we had a unique ability to mobilize in certain ways. We have about 1,500 employees across the state under the Behavioral Health Administration within the Department of Health. So we, back in early April, we started to get involved in doing quarantine and isolation, primarily initially for folks that were chronically homeless and had mental health disorders, that kind of stuff, and mainly people that couldn't otherwise vaccinate or isolate or quarantine on their own. And that's been actually going for the last year, and that expanded actually to doing pretty much all of the isolation and quarantine efforts for primarily Honolulu County over the last year. And then with the emergence of the vaccines back in December, we started to get involved in doing helping out with the vaccine efforts by standing up a point of distribution site on the windward side, and we've been going ever since.
I want to touch on the isolation quarantine in just a minute because that's interesting, but vaccinations are certainly top of mind. You guys opened a point of dispensing over in Kaneohe several months ago, and that has been one of the regular features in the vaccination program. Who's been going there? What kind of numbers have you seen as far as those who've come in to get vaccinated?
Yeah, so we started in December. right around Christmas, actually, we started our first pod, and then right after Christmas, the second one. So to date, we've vaccinated about 60,000 people at that site. Everywhere for, all of the folks that have come through that site are part of the, the progression of, population focuses that the state has had under its allocation plan. So, 1A folks, people who are on the front line, we actually included for us with the director's blessing, a lot of folks that were doing homelessness outreach and behavioral health work, outreach, community case management, that kind of stuff, because we felt very strongly that just like you would consider kind of a nurse in a hospital as a frontline worker, we felt that the people that were going out into the communities to work with very severely mentally ill folks or chronically homeless folks, kind of same thing. So we included those in our 1A workers. And then since then, we've just been progressing with the distribution plan.
I know you've offered the Moderna product there and also the Johnson & Johnson vaccine now, which has come to Hawaii in limited numbers, but we expect to be getting a whole bunch more Johnson & Johnson before too long. And now you've opened up a second clinic in central Oahu that is, at least for the time being, only offering the J&J, the Johnson & Johnson.
Correct. So at our Windward pod, we do both Moderna and Johnson & Johnson. On Tuesdays, we do first dose Moderna. Wednesdays, we do second dose Moderna, and then Thursdays, we do Johnson & Johnson. And actually, we were the first site to roll out Johnson & Johnson. Once it came into the site, we offered it to educators, and we opened in a very short notice. We opened 500 slots, and 500 educators came in and got vaccinated with the Johnson & Johnson. So excited about that. And then in Mililani, we are working with our independent pharmacies such as Times Pharmacy, 5 Minute, PharmaCare, et cetera, to kind of help us get those pods out there and further out from Metro Oahu, where currently a lot of the vaccination sites are concentrated. And, the idea would be to have the vaccine as accessible as possible as we start to move out. So we had our first Mililani date yesterday. Again, 500 people. We offered 500 appointments and got 500 people.
You guys, you have these pods, Mililani, Windward, but you also have that mobile team that's gone out into corrections facilities, into homeless, houseless shelters.
Yeah, so we have, again, really good partnerships with community providers like the independent pharmacies, Project Vision Hawaii, who's been a really amazing partner with us. And just, we talk about in BHA the GSD factor, which stands for Get Stuff Done. And so I think a lot of us pride ourselves in having a 10/10 GSD factor. So the goal is really to get shots in arms and get as quickly as we can to that herd immunity point. And so, our teams are out there doing, like you said, vaccinations in the jails and prisons on Oahu. We're doing homeless shelters. We're doing kupuna housing. We're doing a lot of efforts at sites that are geared toward Native Hawaiian Pacific Islander folks. And so, again, the goal is to do that outreach, bring vaccination to those populations or those folks that may not have as good accessibility to maybe go to a Blaisdell or to go to a Pier 2, and really get those vaccinations out to those folks and do the outreach as well, because there's still some folks that maybe are hesitant and they're not sure. And so we want to do that education and that coordination with them. So we're coordinating with churches, we're coordinating with community advocacy groups, AARP, the city and county of Honolulu. So it's an all hands on deck effort again.
Your team, it seems, is really going after those vulnerable communities that are difficult to reach, the kind of people who we might not see show up at one of the larger pods like the Pier 2 or the Blaisdell, people with either mobility challenges or people who are at high risk of infection. So fabulous. Now let me get back to that ISO-Q, we call it, isolation quarantine. Who kind of qualifies or who ends up in isolation quarantine?
Yeah, so during the course of the last year, the goal was to isolate or quarantine anybody who, overarchingly, anybody who could not appropriately or safely quarantine in their own home or in their own space. And this was primarily targeted towards folks who were, again, some of those kind of vulnerable populations who are in multi-generational homes, where folks don't have the ability to kind of designate a single bedroom and a single bathroom to the person that needed to isolate or quarantine, that kind of thing, and who needed that extra support for, delivering food and stuff like that. So we had kind of two prongs. One was the folks that would come into the quarantine site and quarantine or isolate there. And then we had those folks who could quarantine or isolate at their home, but they didn't have enough supports or family or other community supports to be able to, get food to them because they couldn't go out, that kind of thing. So in general, we had a lot of folks who it ranged from, people who were homeless to, people who were working, 9-to-5 jobs or, fire, police, those kinds of folks who just didn't have the ability to do it on their own.
Eddie Mesereau, I really appreciate your time and the work you guys are doing, because you're out there really doing what you can to protect these vulnerable communities and communities that have been disproportionately impacted. The people who you might not see show up at next to you when you go to get a vaccine at one of the pods. It's really difficult work because you have to get out into the community and you don't maybe don't get the huge numbers that some of these larger pods do. You're doing that really difficult work of getting smaller groups, but again, very important groups because these people are vulnerable to infection. Hey, thanks so much for taking the time to talk to us. As I bid you adieu, I will tell you there's exciting news coming about the number of doses we're going to be getting next week, a whole bunch more. So thank you, Eddie Mesereau from the Behavioral Health Administration.
Thanks, Brooks. Good to see you.
All right, Eddie. And folks, I teased you there by telling you about the vaccine shipment we're expecting next week. And indeed, we are expecting a more robust shipment next week. So this week, we received 68,710 doses statewide. Those are the doses allocated to the state of Hawaii. Well, next week, we are expecting delivery of 81,260 doses. It will be our largest delivery to date of COVID-19 vaccine. So this is exciting. And I can also tell you that we will also be getting, as part of the 81,260 doses, we expect to be getting 8,400 additional doses of that single shot Johnson & Johnson vaccine. And that's going to be going out to all the neighbor islands as well. And in the coming weeks, we're hoping to get more J&J, and we're hoping to see this slow, gradual progression increase in the number of doses we get. And hopefully soon, before too long, it's not a slow, gradual increase, but it may be a dramatic increase. At least fingers crossed. That's what we're hoping. We're all moving toward, as quickly as we possibly can, the opportunity to open vaccinations to everybody age 16 and above. So good news on the way next week with 81,260 doses coming our way. We'll be moving those out the door to the vaccination sites just as soon as we can. So if you're now eligible, please go to hawaiicovid19.com, read all about COVID there, all the things and the services that are available, and make sure you click on the registration tab button right up here. It's in orange, just says registration. Click on it. That'll take you to a description of all the eligible populations for vaccine. And it will also show you a whole bunch of links where hopefully you will be able to sign up, if not now, very soon, for a COVID-19 vaccination. Folks, thank you so much for taking the time. Thanks for your patience through all this difficult time. It is truly a team effort. Hawaii has been fantastic. at masking up, at maintaining distance. And we've just got to continue to do those things, because remember, not everyone's been vaccinated yet. So we still need to do the other things to protect ourselves, protect our families, to protect our neighbors, and protect all of Hawaii. Thanks for watching, everyone. We'll see you again soon here on the Weekly Dose.